Great.
So, the but when we fix that rotator cuff, traditionally it was an open procedure. I do most of them arthroscopically now, so with that camera I was talking about earlier. And what it does is you have less pain after surgery, and it can speed the recovery after surgery as well. The Bankart repair, which is caused by which the Bankart lesion or Bankart tear is caused by the shoulder coming out of place. So if you have if this is the front of the shoulder here, the ball comes out like this. There's a bushing or a gasket that surrounds the shoulder, and that's called the labrum. And if that comes out of place, it can tear that. And many people, especially the younger you are, the higher risk of re-dislocation afterwards. The more likely they are to come out again. And so someone in maybe their 20s is more likely to have that Bankart repair than someone older. An older person, let's say in their 50s, that's not old anymore for me, but that if their shoulder comes out, they're more likely to have a rotator cuff tear. So anyway, we fix that. We do that. How we fix that is to put that labrum back onto the cup where it belongs, and we do that arthroscopically as well.
A question that I had that came to me was, how has your coverage and help with the professional sports teams perhaps changed the way you practice or see patients who have an everyday life?
Well, that's a great question, because when I was actually in Boston before I came here, and they asked me to come here and set up a sports medicine center of excellence, and part of this was team coverage, and I've always struggled with how does that help a hospital? How does covering a team help a hospital? And I think what it does is we have set up a lot of infrastructure to take care of the teams we take care of. And as you know, the Detroit Medical Center takes care of the Red Wings, the Tigers, and the Pistons. And to do that, you need a pretty substantial infrastructure. And the other thing is we learn how to provide essentially concierge service for patients that way. And so what it's done is allow us to put these systems in place, whether it's physical therapy, seeing a physician, any physician, whether it's a dermatologist, an orthopedic surgeon, a primary care doc. We've set this up so the players can get in and see them very soon. Well, what we've done with sports medicine is we've applied those same principles to taking care of our patients. So we really try to speed up the process that normally takes a long time. So we have access for these patients to come in and see us right away. We try to get, if they need an MRI, for instance, we try to get that right away. So we've really tried to ramp that up.
And at the end of the day, as you know, it's so imperative to see a qualified and skilled physician, but the patient experience really has come to the forefront as being something that's very important as well, and I think that's what you're speaking to.
It is, exactly, and what we try to do is treat every patient as if they're a professional athlete.
Yes.
We really do. We try, and we try to go that extra mile for them.
Well, perhaps a little bit on the subject of team coverage. This past season, our Tigers made it to the playoffs, and they did have a fair number of injuries without naming names or particular situations. How do you do that juggling act?
It is a tough juggling act, but I have simplified it in my own mind so there are no conflicts. And what I try to do is always do the right thing for the player. So whatever that might be, I have to think about the short-term things that, for instance, if they're going to play the next game, but I also have to think about their career. I have to think about how this will affect the team. But in general, if I do the right thing for the player, that is going to that's going to help the team. It's going to help their career, their long-term career, as well as get them in the game again. Because they all want to play. They all want to play. They all want to get out there. They all want to help the team. But they also don't want to go out there if they're going to not be able to be at their best. And again, the team doesn't want that either. So we really work hard to balance those things and do the right thing for the player.
And that sounds like a great focus with anybody. And, you know, seemingly the other things probably fall into their natural place.
They absolutely do. And the other thing is just like we do with the players, they always go to whoever the best person is for the best physician, the best physical therapist, whoever that is for them. We really, we do that. We do the same thing for our patients. We make sure that they are, they see the right person and the best person for them.
And speaking of physical therapy, that's an important part of your total specialty.
Sure.
You know, ideally, surgery is a last resort, I would assume, and physical therapy is an important part. And could you tell us a little bit about the role that that plays?
Sure. Now, we are very focused on trying to get people back to health the most conservative way possible. But you know, sometimes surgery is the conservative thing to do. In other words, doing physical therapy would only injure them more. But in general, we really focus on getting them back and trying to minimize surgery if we can. And physical therapy is a very important component to that. Since I've been here since around 2006, we went from 7 physical therapy sites to close to 32 physical therapy sites now. And a lot of that reasoning is because we are trying to use more conservative management, which is actually the best thing for the patient. It's really focused on education. A lot of us don't know a lot about how we can get better, how to be active, a lot of things about body mechanics, things like that. And so we focus actually not only on getting them better right now, but helping to keep them better, for instance, if they have a shoulder problem, not only getting their shoulder better, but helping to teach them how to keep their shoulder healthy for the long term.
And that goes along with taking care of their health even when they're not injured.
That's exactly right. And one thing that we do is we've also expanded to we have performance centers, we have specialty centers for throwing, for golfing, for a bunch of other things, for people so they can learn exercises to keep them healthy at a sport they want to do or just in life. And for instance, I did a knee replacement on someone, and she was very active beforehand, and she wanted to remain active afterwards. And she her knee got better and it was fine, but she then went on to work with some of our body mechanics and performance people to take care of a lot of other things that she was having issues with, and she is so much happier now than when she first came to see us. So it's really, that was very gratifying. I actually just saw her a couple days ago, and she talked to me for about an hour about it, but it was great. I was really, it was music to my ears.
It is, and that can be, that's what it's all about. It's very gratifying, as you had said. So many people end up needing joint replacements, whether it's knees or shoulders, what have you, or hips. And what are some of the trends in the hardware used in this, or kind of getting the alignment correct so balance and walking and so on are in proper alignment?
There's a lot of information out there now. Companies are trying to educate the public on various new things that are out there, and so it can be almost confusing. In the old days, you'd go to your doctor and they'd tell you what they were going to do, and that was it. And now we often go to our doctor. We've looked up a bunch of things online, We've read a lot of information, which may have helped, but it also may have confused us a bit. So I think it's important, if we're talking about knee replacements or shoulder replacements, I think the important thing is that it has a track record. And so I tend to use, unless I'm doing research, in which I would tell the patients that we've got something that we think is going to be far better, and we want to try this. But most of the things I do are fairly tried and true, and because with a knee replacement, you want it to last as long as possible, and so you want it to have a track record. So for that, I want it to have been out, and the materials that are being used to have been out for 10 to 15 years, because I want to make sure that what I do is going to last at least that long. And so some of the materials that are new, you don't always know that. So I'm very careful about using the right materials. And what they've done, for instance, in general, a knee replacement, shoulder replacement, elbow replacement, they're metal and plastic. They are trying to use metal on metal, ceramic on metals. And what I'm talking about is if you have in general, everything's a ball and socket. Knees set up a little bit differently than that, but you have two surfaces that are rubbing against each other. And we have smooth gliding cartilage in our knees that, or shoulders or elbows, that help to decrease the friction that is between those two surfaces. And we have synovial fluid or joint fluid in there that helps to lubricate that.
And you were also involved in making sure that people don't get fractures after the replacements.
Exactly. And what we've done is we've looked at the design of the metal and how it sits on top of, we have two sides to your knee, the side where the thigh bone is and the side where the shin bone is. On top of the shin bone, that's where you're loading that prosthesis or the tray, whatever you want to call it, the metal that sits on top of there. We've been looking at designs of that to make sure that we can decrease the fracture rate afterwards.
That's excellent.
And it's really, that's been very gratifying looking at that and trying to decrease because that's one of the, it doesn't happen often, but that is a complication that can occur.
And as we wind down, Dr. Lemos,
Yes.
you also opened a new office more on the west side of town. You have an office in Warren, and you have an outpatient office now in Farmington?
Yes, in Farmington Hills we have one. It's on the corner of, or just up a bit from the corner of 12 Mile and Orchard Lake Road, and a brand new clinic, and it's exciting because it allows us to kind of share our system with more people.
That's great. That's great. Well, thank you so much for taking time out of your schedule to be with us. Time just runs out.
It does. It does. This is very
But it was
enjoyable.
wonderful, valuable information, and thank you for everything.
Thank you very much.
Thank you. And thank you to our viewers as well. As always, we appreciate that you tune in to see us. Take good care of yourself and those around you. Have a great day, and we'll see you next time.